Washington for about 2.5 years. And then after that, after I had my Washington experience with my wife, we came back to sunny California. We were looking for really clean air. And so we came and settled in Monterey. We've been in Monterey for 15 years, 16 years. And if it takes much longer, it'll be 17 years. So that's kind of my medical background. Board certified long ago and far away, recerted twice. I've actually let that expire, but that's another issue. So anyway, I think one of the first things we should do is pray and just ask for grace. Father, we thank you for your grace, your mercy. We pray that you would just give us grace this evening, give us knowledge, give us wisdom, and things to do with the knowledge that we can acquire. We thank you so much for what you've done in our lives. In the name of the Lord Jesus, amen. The most important thing in giving a talk is you have to at least open with a joke. So you guys might want to sit down for this. So are you guys ready? Here comes the joke. Okay, so it has a lot to do with perspective. So there were these two guys, and they were both pilots. They probably weren't the smartest pilots in the world, but their engines started having problems, and it was like going ba-dum, 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 and they thought, oh man, we've got to land. We've really got to land. And so they did find a landing site, and one of the guys said, I don't know if we can make it. The runway is so short. The other guy turned around and said, man, it's really short. And they went back and forth and said, yeah, it's so short. How in the world can we land on this thing? It's so darn short. And the other guy said, it sure is wide, though. I'll explain it to you later. So we don't steal around here. I purloined this from Dr. Kurt Wohler, who is one of the more eminent teachers in regards to autism. So you'll see Kurt Wohler at the bottom. I'm not Kurt Wohler, contrary to popular belief. So why don't we start rolling, because do a lot of reading. So autism and integrated medicine, a roadmap for testing and treatment. That's not better. This isn't part of it. I liked it. It was probably better than my lecture. Go ahead and run forward. Continuing education. So if we can wait, back. Kurt Wohler does work with Great Plains Labs. I use them extensively, but I don't work with Great Plains Labs. I'm not paid by anybody. Go forward. So these are the assessments that need to be done. I may have to read it off the computer. You do a clinical intake first, you do all kinds of lab testing, and then you start separating things out. I may have to step back. You have to get dietary information, and there are some foundational supplements that every autistic kid should go on. Typically, the digestive system is a huge portion of the treatment protocols for autistic kids. Methylation is also one of those gigantic pieces of the puzzle for these kids. Methylation, MTHFR. If you have a medical background, that should ring a bell for you. That's one of the things that seems like a majority of the autistic kids have. Methyl tetrahydroxyfolate reductase. I put all my pregnant moms on 5-MTHF, about 1 milligram a day, in order to help prevent autism. And then there are other modalities and other labs that can be done. The breakdown, that's not me either. Forward. And then what in the world is autism? And then if we flip the page, and I'm hoping we can actually read it, these are all the identifiers. Difficulty, boy, I'm having a hard time reading this.
It's really focused good.
Okay, so there's social problems. One of the big things is social issues, where the kids can't interact with other human beings. Sometimes they can act better with animals than they can with other human beings. Social is gigantic. It's almost like, if you think about the word autism, they're kind of like unto themselves, and so they can't read other people. And there are all kinds of flavors of that. And some of these are missed in some of the autistic kids. Some of these are totally missing. The kids don't quite meet the autism criteria. So just realize it's a mixed bag. Most of the autistic kids have very poor communication skills. In fact, that's one of the ways I'm able to pick it up early. Oh, that's better, okay. So I may send these kids off for a speech evaluation by speech pathologists, and they usually clue me in, you know, this is really looking like autism. Then we get to do the whole workup. The people that make the diagnosis of autism are typically the child psychiatrists, the developmental pediatricians, or the peds neurologist. And I'm actually none of those. My training is pediatrics, but those are the people that are legally able to make the diagnosis. You have a pretty good idea what's going on, but those are the people that can actually make the diagnosis. And then the kids will oftentimes do repetitive and stereotypical behaviors. They may flap their arms. I have one little guy, the only thing that's left over with him is he takes a straw and he just flips it all the time. He's actually got good speech, but and he doesn't have anything else really going on. He's got friends at school, but the leftover with all the training and kind of massaging his system that is still left is this stereotypical behavior. He's also got a little bit of attention issues, but he's no longer autistic. Go on. These are all kinds of faces of autism. You see all kinds of flavors. My personal belief is you've got a whole spectrum from attentional issues to Asperger's, then there's something called autistic-like characteristics. By the way, these are all going to change in about a week in regards to where you label all these kids. After autistic-like features, then you get into something called pervasive developmental disorder, and then you get a full-blown autism. So it looks like there's a whole rainbow spectrum in regards to what we're seeing with autistic kids. Go on. This is a kid named Jacob. He was a kid that actually Dr. Wollert worked on. Go ahead and flip the switch, and here's Andrew, and here's a little boy named Noah. If you look at Noah, something really bad has been happening with his face. He's actually doing a lot of self-destructive behaviors. Next slide. Here he is, pretty sad kid. He's been smashing his face. Next slide. And these are the walls where he's been smashing his face and head. So these kids are having all kinds of what look like self-destructive behaviors. Remember, these kids really can't talk, they can't communicate. So this is one of the things that we see with autistic kids. I know of one child in the greater Salinas area that I think he broke every one of the windows in his house. This can be a very unfriendly illness for these kids. Next slide. Here he is. And he's tired because he's worn himself out from all the self-destructive behavior he did. Go ahead. This is his room. The whole place is padded. Next. And this is his mom and his grandmother. Trying to realize this can be going on for 24 hours a day, 7 days a week. I don't know that we say autistic, but sometimes just getting a face to what's going on sometimes helps us get a realization as to what really is going on in the community. This is an example of what's happened in the medical community. If you look on the left, this is a child without autism. These kids this particular child has a chronic diarrhea, 3 to 5 PMs a day, recurrent sinus, ear and upper respiratory infections, eczema, bloating, gas, distended abdomen, anxiety, attention issues, irritable, poor sleep. You get the same things in an autistic kid, but typically we aren't working those kids out. So the kid without autism gets all kinds of workups. The kid with autism, typically the medical community just kind of walks away with their hands clear of the child. Next slide. Comorbid conditions, ear infections, asthma, allergies, atopic dermatitis, sleep disorders, headaches, migraines, seizures. Seizures is huge. The estimate right now is about 40% of the autistic kids are having seizures. Or they're having EEGs that are called subclinical, which means they're not having true seizures, but there's something funky going on with their EEGs. And the discussion in the autism community is probably a good number of these kids should be put on seizure meds. So next slide. And this big push is the GI issues. By the way, Doug, my identical twin brother over there, has family members, so I just wanted to introduce him to you all. Doug and Doug. Our parents weren't very creative when they named us, right? So there are some psychotropic drugs that have been used. The two most common ones, actually, that are now okayed by the FDA are risperidol and Abilify. They aren't shown to be particularly effective, but the other thing that's happening is if these kids are having predominantly GI issues, a psychotropic drug is really not going to help them. Unfortunately, that's kind of been the direction of the American medical community. Just realize the firing of that particular gun was probably not in the right direction. Right now, there are only two medications. Kathy was just telling me about a med that's on trial out of UCSF that sounds extraordinarily promising, but that's for older autistics, so I don't know if they'll get it to younger ones. But realize there are only two meds that are actually okayed by the FDA for the treatment of autism, and those are psychotropic drugs. If these kids are having huge GI issues, we've kind of missed what we should have been aiming at. Next slide. These are major problems with a lot of the autistic kids: gastritis, GERD, that's GE reflux, colitis, irritable bowel syndrome, constipation is gigantic in these kids. Motility-based disorders where their GI tract just is not working. Food allergy and sensitivity, overgrowth syndromes. There's something called SIBO that was new to me as of about 8 months ago. It stands for small intestinal bacterial overgrowth. And you know, I was used to a dysbiosis in the lower GI tract, but this SIBO is a little different for me. It's actually upper small intestine where I didn't think any bacteria were supposed to grow, but they do. And that also seems to be a problem for these kids. Next slide. How prevalent are GI issues? So there were 50 children in these two studies. Both of the study groups had mental health issues. One was autistic spectrum, and the other one was developmental issues. I would be suspicious that the kids with other developmental issues would probably also have GI issues, and that those would need to be directed, or at least need to be massaged. And what they found was about 70% of the children on the autism spectrum had GI issues, compared to 42% of the children with developmental disorder other than autism. And then in a typical child with typical development, about 28% of the kids will have GI issues. Next slide. So Arthur Kriegsman is one of the major GI people, and he says GI pathology and autism. There's a description and treatment. We'll see some glorious pictures of GI tracts. He found that a lot of these kids are actually refluxing bile up into their esophagus. That doesn't feel good. Their breath smells like feces. They have very slow motility in their GI tract. H. pylori and Candida infections are identified. Because of the testing I do, I see Candida, which is a yeast in almost every one of my autistic kids that I deal with. There's food avoidance, pounding on the chest, holding stomach, association with tantrums, aggression, etc. It could, and the question that we really need to ask ourselves is, could this be caused by pain? Remember, you've got a child that really can't communicate. So how in the world are they expressing themselves in regards to the pain syndromes they're in? The answer, at least in part, and maybe the majority, is they're acting out because they've got so much pain. Remember the kid that was pounding his head? What if his belly was hurting like crazy? How would we communicate that? Remember, he can't talk. Next slide. Poor intestinal motility, so that the GI tract is just not moving. And that's not good. The major organ for detoxification of your entire system is your GI tract. So if it's not moving, whatever toxins you've got, next slide, I hope. No, that's just showing, it's hard to make this out, but I'm going to step away from the mic, so I'll just pantomime here. What you're going to see is like lymphatic tissue that's really swollen up in the GI tract. Like here, 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 all over here. Highly controversial, I just think it's true. Next page, or next slide. And then there are ulcerations in the large GI tract, more ulcerations in a polyp. There are ways to, you can keep going. This is a way to actually look at the entire GI tract. There's actually a camera that you can swallow, and it'll take a picture all the way down. That's one. Next is, so the answer on this one is, the occasional loose stools for anyone, that may be normal. All the time loose stools, that's not normal. And Krigsman is one of the major players in regards to the autism community and looking at GI tract. Next slide. This little boy is doing a very typical behavior in autistic kids. He's shoving his belly right on top of the table. The feeling from the people that are in the community, in the autism treatment community, is he's dealing with the GI issue the only way he knows, and that's to mash up his belly. And you'll see the kids put their bellies over a table or a chair or something because they are in massive pain. Next slide. Here's a kid that has been doing all kinds of self-injurious behavior. The feeling from a lot of people is this behavior is probably directly related to how much belly pain they've got. Next slide. Here's a kid, Noah, the little child that we saw before. You'll notice he's mashed his right side of his head. He's got bruises all over the place. Realize no verbal expression, so what he's doing is he is essentially, what's a fancy word, he's trying to dissociate from the pain he's got in his belly. Next slide. And here's another kid. The quiz question, of course, is he in pain? Next slide. He was seen by Dr. Krigsman. I don't know if you can make it out, but there are all kinds of ulcerations. And this kid was having world-class GI symptoms, like an inflammatory bowel syndrome. It's kind of like having a fire in your gut, not like you get with the fire in the gut to run for president. This is another kind of fire. All right, next slide. There's a book called The Second Brain. I think it's written by a guy named Michael Gershon. There is an entire neurological network that's in your GI tract, and it can act independently of your brain here. I suspect that God put that together so it wouldn't necessarily have to function if the brain was having issues. Next slide. Actually, Kurt Wohler said, all children except one that I've referred for scoping, endoscopy, colonoscopy, PillCam, had confirmed inflammatory bowel disease. And that's an extraordinary statement. This guy's seen about 200 different autistic kids, and this is his conclusion that there are just gigantic amounts of GI issues with these children. Next slide. This is a test that you can do. I believe it's doctor's data that does this, and you can oftentimes see major inflammatory markers in, I believe that's stool. Yeah, stool analysis. It's called a CDSA. I've finally broken down. There were several companies out recently. They're saying, oh, this is the best stool testing, I think, right now. Doctor's data is it. There are 3 markers here that are showing there's a massive amount of inflammation in the GI tract of these kids. Next slide. This is the problem. You notice I'm going to show you the line, and then I'm going to show you what's happening with toxins. I have a funny view of autism. I believe there are only 2 problems with the kids, toxicities and deficiencies. If the GI tract is not working, these kids are going to continue to recirculate all the toxins. And if you look at the GI tract, you'll notice it's going right over to the portal venous circulation that's going back to the liver, and then back out again. But it's a continual loop. You're never getting rid of the toxins. Next slide. And then the question, of course, has been raised, is it possible that there's some kind of gut-brain connection? And then the findings from this particular study was that there were increased urinary peptides, such as opiate-like substances from casein and gluten. There are several things that go on. One of the treatment modalities that I do with my kids, if the parents will actually listen to me, is gluten-free, casein-free, and soy-free diets. And the reason that's important is because on a lot of these kids, when gluten is broken down, which is wheat, when casein is broken down, and I suspect soy also, there are particles that are opiate-like. And in fact, you can see opiate habituation in these kids. This isn't the only thing that's happening, but it's one of them. Some of the kids have almost no sense of pain. You can stick a needle in them, they won't feel it. And that's the sense in the community is probably the reason for that is because these kids are opiate filled up if they're on wheat and dairy. That's not the only problem. Sometimes these kids have true allergies to wheat and dairy, and some of them just can't tolerate it. So there are at least 3 things that can go on with wheat and dairy, and probably soy. Next slide. So the first pillar of treatment for an autistic child is you have to massage the diet, and you have to get them onto something that is no longer inflammatory. Next slide. And the treatment, at least from Kurt Woller's standpoint, and I agree with him, is you really have to start with diet. Everything should really be organic. Everything should be dairy-free, it should be wheat-free, it should be soy-free. That's kind of my first step. At least that's about 1/5 of my first step with my families. Very interesting study is out of a place called Salinas. Has anyone heard of it? Salinas, I mean. You've heard of Salinas? Okay. It's called the Chamacos study. UC Berkeley and Emory University have been doing an ongoing study for about 10 years. What they have been looking at is the insecticide levels in the mothers that are working in the fields and the subsequent autistic kids. And what they found is there's a 1-to-1 relationship with the amount of pesticides that are in the bloodstream in the subsequent autistic child. So pesticides, so has anybody ever heard of the Gulf War? Anybody here? I see one hand, 2 hands. They're all going up throughout the audience. Okay. So in the Gulf War, the second Gulf War, there was a big announcement that was made. And it was, oh, we found the weapons of mass destruction. We found the nerve gas. So there were 5 barrels that had been found. And this went on for about 5 days, and everybody was happy. Yay! It was, you know, it was a righteous war that we put together. About 5 days afterwards, they said, oh, never mind. It wasn't nerve gas, it was just pesticides. Okay, what happened? So the chemical sniffer that they used to find out if there's nerve gas picked up the pesticides. These are nerve gas for insects. Well, in the overall design of things, they are also nerve gas for human beings. So when we have small amounts of pesticides on our food, realize we just have small amounts of nerve gas on our foods. Do you think that's helpful for anybody? How about 3 times a day, 365 days a year? Do you think that's good for anybody? Do you think that's like nuts? Because that's exactly what we've done with our food supply. And some of us do not do well with pesticides, meaning probably all of us don't. So try to eat organics, and especially on the autistic kids, they will be exquisitely sensitive to these things. It has to do with toxicities. Next page. Highly controversial in regards to whether it makes a difference or not. Any kid that has GI issues, you definitely want to pull them off dairy. I think Woller's recommendations is you pull a child off dairy first for a couple weeks, and then you filter in a wheat-free diet afterwards. And then you need to be on this at least 3 months before you say, oh, it really didn't work. And his recommendations is you go at least 6 months. Next slide. I don't actually look at peptides, I just actually treat patients. But if you do look at these abnormal peptides, by the way, the names of them are casomorphin and gluteomorphin. Can anybody hear the word morphine in those? Because if you can, then you understand what one of the problems we think is going on with these. As they get broken down, you're essentially dropping a morphine-like substance into these kids. And what they found in this particular study was that 87% of the patients with autism, 86% of the patients with schizophrenia had these peptides that look like opiates. So essentially we kind of filled our kids up with opiate-like substances. We can't understand why things are not going quite right. Next page. This is that portion of the molecule. Next slide. And so this is what was found: better bowel function, less constipation, diarrhea, improved skin tone, reduced rashes, eczema, dark circles under the eyes. That's dark circles is pretty typical allergic response. Improved language, eye contact, focusing, and attention. With these kids, there are so many things wrong with them. If you've been looking at the autism community a lot, you notice they use puzzle pieces, right? Has anybody seen those on the websites? The problem with our autistic kids is some of the kids may have 6 or 7 or 8 puzzle pieces. Some of the kids may have 70 or 80 puzzle pieces. Some of them may have 800 puzzle pieces. I have one example of a kid. The only thing the parents did, by the way, when I have an intake, it usually takes me about an hour and a half to kind of verbally abuse the parents and hope that they get on board with the things that I'm telling them. The only thing that the parents did was that they pulled their kid off dairy. That was the only thing. This particular child, guess what the only puzzle piece in his life was? It was dairy. It became totally normal after they pulled the dairy off. It would be great if all of the kids were that way. The problem is some of the kids have 6 puzzle pieces, some have 80, some have 800.
Is sugar ever a puzzle piece?
Sugar does something else. Sugar, we'll get to that. Hold that thought, because maybe we'll actually answer it. Next slide. These are some good books. Julie Matthews is in the middle. She's actually really good. She's out of San Francisco. And then Lisa Lewis, I'm sorry. Yeah, anyway, she's very good. And I don't know who the Cooking to Heal is.
That's Julie.
No, on the right, on the left is Lisa Lewis, Special Diets for Special Kids. Anyway, and Julie has her own website. She's